Hello, my name is Victoria Gonzalez. This report is a final presentation for contemporary health issues being taught by Professor Bonomi at California Baptist University. Today I will be doing a presentation on stress-causing diseases in the body. Stress is anything that causes mental or emotional strain or tension. Stress causes tension on the body and mind. Research shows how chronic stress influences disease formation in the body. This is due to psychological stress that is associated with the body losing the ability to regulate the inflammation in the body. By the body not being able to regulate the inflammation, it can promote the development and progression of disease. Some common physical symptoms of stress are tension headaches like migraines, oily skin, skin blemishes, rashes, dry mouth, jaw pain, grinding of teeth, backache, hyperventilation, heart pounding, stomach ache, nausea, indigestion, stomach butterflies, diarrhea, gassiness, constipation, increased urge to urinate, cold hands, sweaty hands and feet, and hand tremors, etc. The list goes on. This sounds like a commercial when they're advertising a drug and its after effects. And as we can see, all these are reactions that our body has when we are in a state of stress. This is just a tip of the iceberg, so to speak. The symptoms of stress go deeper. There are other more serious diseases that stress causes. For example, cardiovascular disease, diabetes, Alzheimer's disease. The higher the level of stress one experiences and the longer that stress continues, the greater the likelihood of damage to our physical health. So how are these diseases formed or developed in the body by stress? Well, there are two types of stress, the eustress and the de-stress. Eustress can be good because it can serve in a fight or flight situation. Stress prepares our body to engage. How this works is when we are in some type of stress, our mind tells our adrenal gland to release hormones or prepare our body. Some of these hormones are glucose that is shot into our bloodstream to power us up and ready to fight or run. The other hormone is cortisone. This is to suppress your digestion and immune system to focus energy on our muscles. This type of stress is the good kind of stress that produces the desired effect for that sort of period of time that allows us to get away or fight through that stressful situation. However, there is also the bad type of stress, de-stress. That's associated to negative events, for example, death in the family or an illness, or a simple day today stresses like work, college, family, traffic on the 91 freeway. The body normal reaction to stress is to activate the adrenal gland and produce cortisol. When we are in this type of stress, the body produces the stress hormone cortisone, which suppresses the immune system, leaving us susceptible to disease. When our bodies are in a chronic stress situation for long periods of time, cortisol can be damaging and eventually mature into these chronic illnesses. Because when our bodies are constantly bombarded by cortisol, the adrenal gland gets burnt out and is not able to regulate or maintain a healthy balance of inflammation. Inflammation leads for the creation of free radicals that does not allow your body to heal. That eventually results in cardiovascular disease, diabetes, Alzheimer's disease, and others. I downloaded this slide that gives a brief information on how the oxidative damage disease cycle works. And this is basically showing inflammation, oxidative stress, and disease. For example, this is how when you get the simple flu and how the oxidative damage disease cycle works through that. So you get the simple flu, your body's immune system will attempt to fight it. The flu creates free radicals and swells up the tissues. The body needs to suppress the swelling, so the adrenal gland produces cortisol to fight the inflammation. However, due to the lowered immune system, the virus is harder to destroy, thus more swelling and more free radicals are developed. Immune system's response can lead to free radical creation as well, while swelling can also lead to free radical creation that causes damage known as oxidative stress. Inflammation on the body becomes overrun by free radicals, and the damage is known as oxidative stress. As on the slide, stress leads to inflammation, vice versa, which leads to disease, vice versa, and back and forth through oxidative stress. So it is a vicious cycle. Moving on to cardiovascular disease. The study shows how stress causes inflammation and the cardiovascular disease. When the mind and body is put through repeated stress, it causes major damage to our body. When our system is exposed to stress, the nervous system causes the release of various stress hormones in the body that cause inflammation to the cells and damage the arterial wall that causes cardiovascular disease. This is found in Black and Garbett, one of their journals that they wrote. This means that if you are under chronic stress, your body will produce stress hormones that cause inflammation, which causes the plaque buildup in the arteries and eventually cause the arteries to narrow, making the blood harder to circulate throughout your body, potentially causing a blood clot that could kill you. This is a very serious and concerning situation. So moving on to diabetes, there is a close link on stress that causes inflammation, and this triggers the degeneration of other bodily functions, which in turn are the causes of diabetes. For example, inflammation is the main cause of obesity, which the result is diabetes. Diabetes is a pathway to insulin resistance, which is for cause of alarm because it seems that stress is causing the inflammation that causes so many of the most common diseases that are plaguing many people in this country as well as in the world. It seems that everyone is getting diabetes and it cannot be stopped. Even healthy people and children are getting this disease. In the Journal of Clinical Investigation, it states, recently it has become clear that inflammation signaling pathways can also become activated by metabolic stress originating from inside the cell, as well as by extracellular signaling molecules. Next, we have Alzheimer's disease. When inflammation develops in the brain, it generates high level of free radicals that generate more inflammation, which in turn creates more free radicals and consequently more plaques. This kills neurons faster and quicker and quickens the spread of the disease. In one nationwide survey from the American Institute of Stress, 4 out of 5 doctors reported that baby boomers as young as 35 had complained of mild congenitive impairment, MCI, that has been previously been seen only in senior citizens. These include not only difficulty remembering names, but forgetting where you left your keys or glasses, or when you walk into a room and forget that what you were in there to get. In almost 90%, the leading cause of this type of intermittent memory impairment was increased stress from work or personal problems. On the other hand, MCI also seems to increase risk for developing Alzheimer's. Alzheimer's disease is always fatal. Its course is unpredictable, and the order of appearance and severity of different symptoms and signs can vary. Early diagnosis can be difficult since the first complaint is usually loss of memory for recent events or familiar names. But this also occurs with normal aging and is now being seen in younger people due to stress. While that doesn't show that stress causes AD, we do know that stress causes a decrease in the size of the hippocampus part of the brain, and that is also consistent finding in Alzheimer's patients. Patients with elevated cortisol due to the depression or PTSD complain of memory problems. The mind is a beautiful thing. We must protect it. So are other organs like our heart and keeping our insulin levels in check. So how do we accomplish this? How do we protect ourselves from these ailments? Well, this is done by employing some stress management techniques and learning coping skills for stress. As our Textbook health, the basics. Stress is an inevitable part of our lives. However, we can take first step managing these stressors that have negative effects on our bodies. But first, we must acknowledge that we're having a problem. According to the Journal of Alternative and Complementary Medicine, the study points out that some students will use the denial as a strategy. It shows how this is a negative way of dealing with stress. Stress will not go away if you don't think about it, and it will cause many negative health issues if you don't deal with it adequately. And the strategies that many nursing students have adopted to deal with the stress are the following. For example, they have implementing time management, listening to music, exercising, and developing a support network. These techniques work for me, so I know that they're good. Another way of managing stress is by relaxing the body and soul. This is done by the human touch. A relaxing massage can reduce your stress to ease and allow for the body to reduce inflammation. Another positive effect of massage therapy are for the betterment of immune function. When the mind and body relax, the body stops producing stress hormones and allows for the inflammation to subside and the body to repair itself and go back into balance. This allows for the immune system to fight dangerous free radicals from running amok in the system. Another technique is singing worship music by praising our God. There are multiple studies that show how spiritual music and song of praise has a positive effect on the body and mind. From the article found on the Gerontologist Journal, it shows that to cope with the stressors of life, you must praise God and sing praises to Him. By releasing the stress from our mind in song, it will cause for any inflammation in our bodies to subside. The study was conducted on the following participants that experienced one or more family deaths that included the caregiving and ultimate death of a spouse, parenting, sibling, or child. These experienced life-threatening illnesses, including heart disease, cancer, stroke, and unintentional injuries, all leading causes of death among African Americans. Participants also described stressful chronic and functionality limiting illnesses that include kidney failure, insulin-dependent diabetes, and arthritis. The other important thing to note is that work-related stressors were derived from the demands of the job or conflicts with coworkers and anxiety and depression participants associated with them. So the results of this study shows that the use of religious songs improved overall health and outlook on the types of stress that they face. Singing and praising our God allows us to focus on His word and His promises. Positive words of love, acceptance, and affirmation teaches us that we are made for more and we stop stressing. This is when the Lord grows our faith in Him and makes our circumstances more tolerable. Stress will never go away, and Jesus knew this. He states in Matthew 6:34, "Therefore do not be anxious about tomorrow, for tomorrow will be anxious for itself. Sufficient for the day it is its own trouble." To summarize, we learned that stress causes diseases in the body. By allowing accumulation of the stress-producing hormone for a long period of time, we are bound to develop a major disease or diseases. It is vital that we acknowledge that if chronic stress is a factor in our lives, and if left untreated over a long period of time, it will produce great damage. Once we understand the effects in our bodies due to stress, we will be able to better equip ourselves on how better to manage it. By understanding the process or the results of uncontrolled distress, one can better gauge our lifestyles and develop coping skills and teach them to others. We must learn how to manage it if we desire to live long and healthy lives. Going through this course has truly inspired me to change the way that I view my own health and those around me. I want to thank Professor Bonomi for her love of teaching about health and enthusiasm that is transferred through this online course. I am now aware and equipped and ready to take immediate action and live a more abundant life in Christ and live out His purpose in my life. I will Give thanks to you, for I am fearfully and wonderfully made. Wonderful are your works, and my soul knows it very well. Psalms 139:14. God bless you all. Thank you.